Welcome to our channel MCQ1. In today's topic we will going to cover top 30 nursing MCQ. So let's start the video. Spinal anesthesia is administered in which space of the body? Epidural space, subdural space, subarachnoid space, intrathecal space. The correct answer is option C, subarachnoid space. Spinal anesthesia is typically administered at which level of the spine? Cervical region, thoracic region, lumbar region, sacral region. The correct answer is option C, lumbar region. Which of the following conditions is also known as trisomy 21? Turner syndrome, Down syndrome, Edwards syndrome, Klinefelter syndrome. The correct answer is option B, Down syndrome. A patient has just drunk a cup of hot tea. As a nurse, how long you should wait before taking the patient's oral temperature? 5 minutes, 10 minutes, 15 to 30 minutes immediately. The correct answer is option C, 15 to 30 minutes. What is the average length of a newborn baby? 30 to 35 cm, 40 to 45 cm, 50 to 55 cm, 60 to 65 cm. The correct answer is option C, 50 to 55 cm. What is the medical term for thinning of hair? Alopecia, hirsutism, hypotrichosis, hypertrichosis. The correct answer is option A, alopecia. Cough-like spots are a typical sign of which of the following diseases? Rubella, chickenpox, measles, mumps. The correct answer is option C, measles. According to health guidelines, for how many months should breastfeeding exclusively be given to a baby? 2 months, 4 months, 6 months, 12 months. The correct answer is option C, 6 months. Otitis media is the inflammation of which part of the ear? Outer ear, middle ear, inner ear, eardrum. The correct answer is option B, middle ear. The removal of an entire lung is known as what? Lobectomy, pneumonectomy, thoracotomy, bronchotomy. The correct answer is option B, pneumonectomy. Which eye structure receives visual stimuli and sends signal to the brain? Cornea, lens, retina, iris. The correct answer is option C, retina. Which cranial nerve is affected in Bell's palsy? Cranial nerve 2, cranial nerve 7, cranial nerve 10, cranial nerve 12. The correct answer is option B, cranial nerve 7. Which positive sign can be seen in deep vein thrombosis? Homan sign, Murphy sign, Kerning sign, none of these. The correct answer is option A, Homan sign. Which neurotransmitter is primarily responsible for stimulating sweat production? Dopamine, acetylcholine, norepinephrine, serotonin. The correct answer is option B, acetylcholine. Which antibiotic is commonly used to treat staphylococcal osteomyelitis? Penicillin, vancomycin, ciprofloxacin, azithromycin. The correct answer is option B, vancomycin. An ischemic stroke occurs due to bleeding in the brain, blood clot blocking an artery, excessive electrical activity in the brain, bacterial infection in brain tissue. The correct answer is option B, blood clot blocking an artery. What is the term for the episode of menstrual bleeding? Menopause, menarche, dysmenorrhea, amenorrhea. The correct answer is option B, menarche. Which of the following findings is most commonly associated with bacterial meningitis in cerebrospinal fluid analysis? Elevated glucose levels, decreased protein levels, high white blood cell count with a predominance of neutrophils, clear CSF afferents with no cellular presence. The correct answer is option C, high white blood cell count with a predominance of neutrophils. What is the purpose of the Braden scale in nursing? Assessing risk of pressure ulcer, evaluating pain intensity, monitoring blood pressure, measuring respiratory rate. The correct answer is option A, assessing risk of pressure ulcer. A positive chuestic sign is a sign of which of the following conditions? Hypercalcemia, hypoparathyroidism, hypocalcemia, hyperkalemia. The correct answer is option C, hypocalcemia. Which type of cancer is commonly treated with radiation therapy? Diabetes, leukemia, brain cancer, osteoporosis. The correct answer is option C, brain cancer. Which of the following is a common cause of ischemic stroke? Hypertension, arterial embolism, head trauma, hypoglycemia. The correct answer is option B, arterial embolism. What is the most common initial symptom of a subdural hematoma? Severe headache, loss of consciousness, gradual onset of confusion and drowsiness, sudden visual disturbance. The correct answer is option C, gradual onset of confusion and drowsiness. Development of clot in the vein is known as vasculitis, spasm, thrombosis, stenosis. The correct answer is option C, thrombosis. The joint most commonly affected by gout is the knee, elbow, big toe, hip. The correct answer is option C, big toe. Deficiency of vitamin B12 may cause beriberi, night blindness, pernicious anemia, none of these. The correct answer is option C, pernicious anemia. Loss of smell is called aphasia, insomnia, apherexia, anorexia. The correct answer is option B, insomnia. Which of the following complications may arise from excessive use of oxytocin? Uterine rupture, water intoxication, fetal distress, all of the above. The correct answer is option D, all of the above. Which of the following is not a common symptom of Parkinson's disease? Resting tremor, muscle rigidity, confusion, postural instability. The correct answer is option C, confusion. Which structure receives stimuli and sends signal to the brain? Axon, dendrite, synapse, neuroglia. The correct answer is option B, dendrite. Thanks for watching. Subscribe MCQs 1 for latest informative MCQs.